starting now.
Ivan. Okay.
Hi guys, welcome to my channel. And I have another special guest. Hey! Actually, Larato, introduce yourself.
My name is Larato.
And
Auntie's friend.
what do you do? Like, what's the relevance of your appearance?
I'm a medical doctor.
Yes. So, as you guys should have seen from the title of the video, we're talking about medical negligence, and I thought like it would be like beneficial to have two perspectives, from a legal perspective and also from a medical doctor's perspective. I also do think that people generally know about medical malpractice, right?
Mm-hmm.
It's not like an area where people don't know, I can sue a doctor.
Yeah.
They know, like there's a lot of people suing out there for medical malpractice.
Now
So,
more than ever.
yes. So it's not really to give information, well, I guess in a way.
Yeah, but don't use it against us. Like, that's not why we're here.
It's just medical malpractice from two perspectives. And so Lorato's gonna answer some questions that I have come up with, and hopefully that information can equip you tomorrow should you have a medical claim against a medical doctor.
Hopefully not.
Are you ready?
Ready as I can be.
Hey, what's medical negligence?
So it's basically when acceptable standards of medical practice are not followed or are not done. So there's certain things that you are expected to do without fail. So when you start doing things you're not supposed to do or not doing what you are supposed to do, then that's when, problems can arise. Also, when you perform certain procedures or any procedure and you don't get informed consent either from the patient, if the patient is a minor or unable to consent, then obviously you need to get consent from the guardian or the next of kin, or whoever's sort of the next best person in the event that they can't give their own consent.
Then a person would have a claim for medical negligence. Or medical,
Yeah.
There's a possibility of someone proving medical negligence in those circumstances.
Yes, in those circumstances.
All right, so from a legal perspective, I know that it's when there is a standard of care that is expected on a medical practitioner, and when they breach that standard of care, then that could give rise to a medical claim, a medical negligence claim, if that breach results in a loss or a damage or
Injury, death.
an injury or whatever. Next, why do doctors make patients sign indemnity forms?
Okay. So the reason why is firstly to inform patients of what the procedure is. So that's why it's usually called informed consent, not just consent.
Yes.
So then you basically let them know when they sign a consent form, you always explain what procedures are available firstly, what is the best procedure for them, complications that can arise. So if it's an operation, for instance, complications that can arise before the operation. So perhaps while the patient is maybe getting anesthetics. Intra-op, if something goes wrong and they cut your bladder instead of your uterus. Post-op complications, if you bleed to the point where you now have to have your uterus removed completely, for example. So all those things are explained so that when you sign, you know what you're sort of getting yourself into, and if it does happen, you can't then come back and be like, no, but you never told me, you never said this, you never said that. So it's not entirely your own risk, but it's essentially just to let you know the pros and the cons of the operation, and also just consenting to a lot of like operations. When it comes to operations, you're also consenting inevitably to the possibility of receiving blood while you're getting the operation done, because obviously if you're knocked out and you're under anesthetics and you now need blood urgently and you can't get consent, obviously because the patient is now not responding, you sort of make provision for that beforehand, so that should the need arise,
The patient's consented already.
Already, yes.
Okay, and then also what I do know from a legal perspective is that an indemnity form, or the consent, cannot include a clause that excludes gross negligence. So you can't say in the form, doctors are not allowed to say, in the event that this and this happens, if it's like constitutes gross negligence, you can't indemnify yourself from that. So in other words, you do something bad, you will still be liable, regardless of the fact that a patient has signed an indemnity form. That's true. And also there's also a legal duty on doctors to inform patients of a particular clause in the indemnity form. For instance, we do expect patients to go through the forms, but we assume sometimes they don't go through every clause, but there might be a clause that is very, very important or integral to like the decision making that you would have the responsibility of pointing out to the patient.
So yes, you do get those situations where, for instance, if a patient is supposed to have an amputation of the foot, for example, right? And then while you're busy with operation, you realize that there isn't enough blood supply sort of above the foot. So you realize that there's necrotic tissue, and you obviously have to remove it, because if you don't, then it's going to spread and more of the leg will die. And then you make that decision intra-op that actually it's not just the foot that's going to go off. Now it's everything just up until below the knee or above the knee. So you sort of counsel the patient, and you include that as well in the consent form, that it's plus minus above the knee, even though it's supposed to be below the knee, for instance. So there are certain situations where you do need to sort of make
you need to point out a specific clause in the indemnity form, informed consent.
Based on the procedure.
All right, so if I am a patient and I think I have a medical claim, who do I sue? Who do I sue?
Okay, so essentially it depends if you're in private or public. So with public hospitals, a lot of the time, although you are suing the doctor, it's the hospital that takes responsibility, because we're employed by the Department of Health, right? So essentially the state then takes the fall for you, if I can put it that way, as opposed to private, where you're now an independent doctor and you sort of do things independently. You're your own employer. So then the patient would sue you as an individual, and you would then have to, I suppose, pay for that.
And that's why it's important for you guys to have insurance.
Yes, it's very, 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 very important to have medical insurance, particularly when you're in private practice, because again, that's when litigation is probably highest in public, and also that's where the individual takes the fall for it, as opposed to in government, where the state essentially then takes the fall.
And that's pretty much what we also learned in like medical malpractice at school, is that in public hospitals you can't sue a doctor in a public hospital for medical negligence. That claim would be against the state or the Minister of Health, whereas in a private hospital you'd sue that particular practitioner. Or what about nurses? You can sue the hospital as well, right? You can sue the hospital.
And then there'll be hearings where the involved individuals obviously then called in for a hearing or a meeting with the victims or the patient. And I guess everybody has a chance to, put their case on the table and explain, and then the notes are brought out, the files, investigations, and everything's sort of put on the table for everyone to see, so that it's clear, I suppose, what went wrong and why.
And that it was actually negligence that led to the loss of the damage,
as opposed to other causes.
And I heard a very interesting thing from Loretta today. She said,
wow.
And I was like, what? But not all doctors pay insurance.
So now, that's the thing. So again, it's that whole private versus public.
But I mean, you could still be sued, as you were saying earlier, that there is that paving the way for doctors in public hospitals to actually now start being liable for claims against the state instead of the state.
Yes.
Like it's something that's slowly starting to creep in. So then it means that medical doctors in public hospitals must now start taking, active steps. Hello. what the?
Cry. So yes, I heard that was in the pipelines. I don't know how far they are in terms of actually getting that process underway, but they had mentioned that yes, at some stage they want to now change things in such a way that when you are in public, even if you are in public, you as the individual will be held liable as opposed to the hospital or the state.
There are like a lot of pros and cons about that, and we spoke about that earlier about the fact that doctors in public hospitals are obviously overworked. And they are more prone to making mistakes, not necessarily negligence, but
mistakes.
Obviously, negligence is negligence if you were negligent, but it would be unfair though to have like the same standard of care expected of doctors in public hospitals to those in private hospitals, because they just don't deal with the same amount of work or cases. It's just not the same. So I feel like it should be like maybe like apportioned liability. Like you'd sue the state, but then to the extent that the negligence was so gross that you can't divorce that from the doctor, then you'd be like, actually, he was suing you as well. This is my opinion, though. Like, this is my opinion,
But then I think they would then have to change conditions in public hospitals.
Of course.
You are not overworked and you're less likely to make mistakes.
Yes, because the other factor that I consider is that like state resources are really tight. So can you imagine now they're saying like there's so many claims that are claimed against the state in medical malpractice, and they have to have a budget for these things, but they're actually not really the one responsible for the act. You see, like I get it, like it's a fine line, like you understand what I'm saying though.
Where does the money come from?
Where does the money come from, So I do think that they must make it possible to sue the individual doctor, but having considered other things as well that don't affect people in the private sphere. So they factor that in so that they sort of can get like some sort of fairness between the claims against doctors in public sphere and doctors in the private sphere.
I guess, but I think also as well, like in public, because as a doctor you specialize in public. That's where you do your training and like your learning, as opposed to private where you are a specialist. So you've done your training, you've done your 4 years of specializing, and now you should essentially know what you're doing. So I think it's a bit like tricky if you want to now open a case of negligence against someone who's still learning and still training, as opposed to somebody who's now fully specialized.
Of course.
So I think it will probably it will be difficult to decide like to what extent must the individual then be held responsible in a government hospital.
What cases have the most medical negligence claims?
Okay, so from what I've seen and heard, it's usually obstetrics and gynecology, but the obstetrics part. So that would be like pregnant women, essentially because they're dealing with at least 2 patients, so it's the mom and baby. So a lot of complications can occur with pregnant women during the pregnancy, during delivery, and after delivery, and even 5 years down the line when they realize that, hang on, something's wrong with the child, and when they trace it back, they realize something, I don't know, the baby was dropped on their head, for instance, when they came out, or certain things that could have been diagnosed during pregnancy and weren't, and then you only realize that once the baby's born. I think obstetrics, from what I've heard, has probably the highest claims. Then I think surgical operations as well. So I think, because I think essentially because you cutting people up, and whenever operations are involved, there's a whole lot of like complications that can result thereof. So as far as I know, I think obstetrics probably has the highest.
Yeah, and it makes sense, yes.
Yeah.
That's also why they pay the most insurance.
They do. They pay a lot. Apparently, don't quote me. But I was speaking to a gynecologist, obstetrician / gynecologist earlier on, and he was just saying that they pay anything from 20,000 to 70,000 rand a month for medical insurance. So that gives you an idea. You know?
But they also make a lot of money because they give birth to a lot of babies.
They do, and I think that's probably the one field that will always have patients as well. People always, giving birth. So they generally are very busy.
Yeah, when they have to protect themselves.
For sure.
Negligence. This is very important because of the times that we're living in now.
Okay.
Can I have a claim for medical negligence relating to COVID?
So I think it depends on where you are. So if you're at a hospital, for instance, that has oxygen tanks and ventilation and the works, and your oxygen saturation is below what it should be. So basically, if you are requiring oxygen and you don't get it, and it's pretty clear when you need oxygen, and if you don't get it, depending, like I'm saying, where you are, like tertiary institutions usually do have access to like oxygen tanks and stuff, although limited now because of COVID. So I don't know how far you can go in as far as laying a claim
for negligence.
Yeah, because there's probably like 100 oxygen requiring patients and like only 50 oxygen tanks, for example. And not everyone will qualify for ventilation or ICU beds. So I think it's very it's tricky times. So I don't know how far you get with something like COVID.
Is it possible? I do think so. I do think, can you misdiagnose somebody where they actually have COVID, but you don't pick that up, and then when they're about to die, it's clear that they need oxygen, and then at that stage, that's when you provide oxygen for them. And could I then say, actually, if you had picked it up earlier that I had COVID, we wouldn't be in that emergency situation where I actually ended up dying because I didn't have oxygen, and you were supposed to pick up that I had COVID all along. So
I suppose to a certain extent you can. But again, that I think probably depends on where you are, because now it's probably changed, but in the beginning when COVID started, not all institutions were offering COVID tests because not all of them had access to COVID testing. And that's pretty much the only way you can really prove that someone has COVID, is if you take either a nasopharyngeal swab or an oropharyngeal swab, and then it shows this person has COVID. So in the absence of that testing, where you're just using clinical acumen because you don't have access to the tests, it can become a bit tricky because it can present as a pneumonia, for instance. And then only to find out later when you need to be transferred to a hospital that then does have access to COVID tests, that's what it was, So I think it's also very much dependent on the facilities that are offered at that institution and how much can possibly be done to help you. So I think if the hospital, however, does offer COVID testing and it wasn't picked up because the test was not done when it should have been done, I think then you probably are well within your rights to want to, open a case or, But I think in places where, for instance, facilities don't allow for certain things to get done, then it becomes very tricky.
I do. I was wondering, what is the status now of medical negligence claims now with COVID? Are people succeeding? I guess medical negligence claims do take a while to get finalized. 2 to 3 years and whatever. But I wonder if law firms are actually getting those type of cases now, and to what extent one would actually be liable, because I think COVID is just so tricky.
It is. And I think because it's changing every day. We find out new things all the time. So nobody really has full information as about COVID. So I think that's the one area that sort of everyone is still trying to find their feet and sort of figure out. So yeah, I think it is a very tricky area.
Yeah. Do patients have a say in how long you guys keep them in hospital?
So no, they don't, because they came to hospital seeking help from medical experts who will then decide how long they need to be kept in hospital. However, there are situations where a patient can sign RHT, which is refusal of hospital treatment, which means you are saying, listen, I'm done, I want to go home, I'm signing. If I walk out of this hospital and I collapse at the gate,
I will nothing to do with
I will not hold the hospital or its staff members responsible. And also when you go home, you aren't given medication, because once you're not being discharged, you are discharging yourself, you're removing yourself, you know. But there are situations like with mental health patients, so your psychiatric patients and your pediatric patients, where you cannot sign refusal of health treatment, so refusal of hospital treatment. So with psychiatric patients, if they are not voluntary, so if they are admitted as involuntary patients, as in patients who obviously brought by family or friends, but they don't choose to be there, but are also not in
the right frame of
mind. Yeah, you know, so they aren't in the right capacity to agree to being admitted, essentially involuntary. Then you have assisted, who also can't necessarily make the decision to be admitted, but they are not denying admission. Those are your assisted. So if they are admitted as either assisted or involuntary users, no family member, spouse, child, mother, father, wife, husband can come and sign them out. Then they fall under the Mental Health Care Act.
Oh, I see.
Which they are now no longer, do you know what I mean? So the family no longer has a say. We don't even have a say, in the sense that now if you want to take them home, you have to sign an appeal, which will go to the review board. And they are then the ones that will have a case, and they'll say, okay, why do you want to take the patient home? Doctors, what have you found? Is this patient fit? They'll, you know, so it's no longer like a family then deciding when to take the patient. Now it's escalated. Yeah. And the same thing with children. According to what is it? I'm not sure which act. But basically, with kids as well, as soon as they become admitted, you can't necessarily sign RHT. I was speaking to one of my friends who works in the pediatric department, and she was just saying that with them, again, they can't sign them out. They have to go to the police station, where they will then have to open a case and take that to the magistrate. And the magistrate court will then have a hearing or a seating setting, where they basically then have a whole case, and then the family must state why they want to take the patient. Then the doctors will say, these are the reasons why we've kept the patient for so long, and this is what we're doing, and the patient cannot go home for such and such reasons, you know. So yeah, it does differ. But yeah, particularly children and psychiatric patients obviously can't consent for themselves in most cases. Then we escalated to the necessary bodies.
Do you know of the story of the lady who died recently from COVID? Who wanted to leave the hospital, and they were like, no, you can't leave. Like, there was like it was on Twitter, it was like trending on Twitter actually, like a month ago. Apparently, like, she was chatting with her friends on a WhatsApp group or whatever, and she was just saying how, no, they're trying to kill me and whatever. Look, this is informal now, please. It's informal. But she was saying in the group that the doctors don't want to let her go, and she wants to go. She feels fine. She feels like they want to kill her, but they wouldn't let her leave. Now then she dies like 2 or 3 hours later.
While she's in hospital.
Yes, while she's in hospital. Okay. My thing is, they kept her there, outside of her will, and she died. Can I claim for medical negligence? Because I mean, the thing there, I mean, like, I hear what you're saying. Like, you guys obviously know why you're keeping somebody in, you know, and they're saying they want to leave. At least give her that form you said so she can leave.
Refusal of health treatment.
But they didn't. So now what?
Why didn't they?
I don't know. I mean, obviously you don't know the full story, you don't know the
Yeah.
full facts, but I mean, on what we know, to me it sounds like she was kept there against her will. And then she died.
But it sounds like then she probably wouldn't have been able to survive outside of hospital if she was maybe like oxygen dependent.
She wasn't, that's the thing.
Really?
Yeah, she said they're gonna put me on ventilators and I feel fine, I can breathe. I don't know why they wanna put me
No,
on ventilators.
yeah, if there was a need for ventilators, because here's the thing, you can feel fine. But the thing is, what we use a SATS monitor, which is like this little gadget that we put on your finger. And it basically senses your oxygen saturation. So you might feel fine, feel that you're talking, you're breathing fine. But if it's because the normal is so from 92% and above, right? So if now 90s is still okay, but anything below 90%, when your oxygen saturation is in the 80s, it essentially means that you're not breathing enough oxygen in, or not enough oxygen is being carried by your blood.
Even if you feel fine.
Even if you feel fine, you can be deceived by your own body. So, and that's one of the criteria that is used. Last I checked, when it comes to discharging COVID patients, you look at the oxygen saturation as well. If it's in the 80s, that person isn't fit to go home and may need oxygen supply or ventilation or whatever the case may be. So that's, from what I can think, that's probably why they were trying to keep her, because she might have felt fine,
But she wasn't.
but her lungs, were unable, would have
Also,
been unable to
what's
cope.
the story about the fact that the air is cold?
So I suppose it comes out of the tank cold, essentially.
But I mean, it's like every time before people die, they'll say the air is cold, the air is cold. Why?
So basically what happens with oxygen, right? So when it's cold, it's more dense, which means it has more oxygen molecules in it. And obviously the more oxygen you have, the better it is for your lungs if your oxygen is required, as opposed to hot air, which has less, because it's less dense. So that's usually why the air would come out cold.
And that's why they say you're talking hot air.
Yeah, because you're talking nothing.
Yeah, I didn't know.
Now you know.
But that's not the cause of death, yeah.
The cause of death is more related to the pathology and like your lungs not being able to cope with the infection and the responsibility of still having to breathe and like provide oxygen to all your organs. So that's...
Hey, you learn something every day.
We keep learning, stay learning all day, every day.
Look, if I got COVID and I thought I was dying, I would not go to the doctor.
Why?
I'll survive at home.
How? If you think you're dying, you're gonna survive it. How, Sway?
It's possible. It's possible.
It's unlikely though.
I'm just afraid. Like I'm afraid. I'm just afraid because so many people you hear they go to the doctor, then they don't make it out. Some do. I just wouldn't go. I think also I just wouldn't want if I feel like something is being done against my will, like I'd be like I go crazy, like no, but I don't want to do this thing. Especially if I start feeling fine, like what you're saying now, but actually I'm not okay, and then you're like putting me on. I'll be like, oh what? No, I don't want to be in this situation. So I'd wait to be fine at home, unless like it was clear I'm dying at home. Then I'll be like, okay, rush me to the doctor because look, I'm gonna die anyway.
Yeah.
Might as well go to the doctor. Okay, and then I think the last question I remember it.
Do you?
Yeah. Are you aware of any medical negligence claims that were successful against doctors that are in your proximity, or like tell us a bit about claims that happen against you guys? Like, what happens?
Okay, so I'll mention maybe 2 instances, right? So when I was an intern, and basically, so I mean, obviously as interns you always need to work under supervision, Ideally, that's how it should be done. So we had a colleague of ours who basically had a patient. I think, yeah, she was a gynae patient, and then she came to casualty. They called the people that were on call, and then my colleague went down and did an ultrasound on her. But obviously, because ultrasounds are still fairly new, in the sense that we were still getting trained and taught, how to operate an ultrasound machine. And he thought that it looked like everything was okay, right? That there was no danger. The patient was pregnant and bleeding, so he did an ultrasound and everything looked intact.
Yeah.
Didn't look like there was anything alarming. Only to find out later on that it was an ectopic pregnancy, which is a gynecological emergency. It's an obstetric emergency, but it's an emergency nonetheless. And that person needs to be rushed to theatre.
Yeah.
Because obviously one of the complications of an ectopic pregnancy is if it ruptures and then the patient can bleed and possibly bleed to death. So he luckily did not discharge the patient, but he was just like, yeah, no, just, take it easy, sit there, and I'll get a second opinion. But I mean, had he had let that patient go home, it could have been something completely different, So he was called in to say, why didn't you act quicker, or why didn't you prepare for theatre and those kind of things? But because he was an intern, and I suppose during internship and community service, you're not necessarily held responsible because you're still working under supervision. So he didn't get in trouble, but I think it was a very good learning curve for all of us, just to make sure that when something is wrong, you act on it, and when you're supposed to be under supervision, to make sure that you are indeed working under supervision to avoid those situations. And there's another case at another hospital that I won't mention. Very recently, actually, there's this hospital where there was a patient who was admitted there, and apparently the patient went for a good 10 hours without getting any food.
Everybody knows.
Yeah,
it wasn't 10 hours though. It was 100.
Oh, yeah, 10 hours is nothing. My bad. Sorry, 100 hours. And the patient was supposed to be seen by doctors and nurses, and apparently wasn't seen for a couple of days as well. And essentially was neglected, So from what I heard, they are investigating the case, but the medical professionals that were involved, so the nursing staff and the doctors that were involved, were also in the investigation. I just don't know how far they are with that. But yeah, things like that definitely do happen quite often.
I remember when I worked in the medical negligence department, at wherever I worked at. I don't mention names.
Yeah, no names.
But it doesn't matter. This is like this. Well, there was a lady who was claiming for medical negligence, and what happened in her case was that she says, like, when she gave birth, that she apparently midwives can deliver the baby.
Yeah.
It doesn't have to be the actual doctor, right? So then the midwife didn't stitch her properly. I think I must have told you the story before.
No, you didn't.
Well, anyway, the midwife didn't stitch her properly. So is it the rectum?
Yep.
And the other one warped into one hole.
Oh, hectic.
Yes, because they didn't stitch her properly. It's not funny. Like, it's actually quite like traumatizing, right? But with her, our thing was prescription. I remember that it took her so long, but she said she didn't know that she actually had a proper problem. Her mom told her that no, because she confided to her mom and said, look, I'm having this issue, and the mom sort of made it seem like it's normal, like, every time you give birth, these things do happen, your stools might be loose or whatever, so it will get better, and it never did. But she says the reason why she never claimed was because she just assumed that it was normal and that she'd get better over time. But then, like, it started being like really like obvious that something's really wrong. And then upon examination, they realized, wait a minute, there's one hole. Not two, one. There's one. Yeah, right, hectic, hey?
That is quite devastating.
Yeah, so she has to have like reconstructive surgery and all of that. But obviously that she will claim, she was successful with her claim, and they'll pay for all of that. And she also got like general damages, like I think it was like $500,000. At the time I was like, this is not a lot of money.
Yeah, I mean, for going through
so much trauma, $500,000.
Yeah, that's
it's
true.
nothing, hey? But I remember sitting in the trial, and I really loved this. This is why I know I need to work in court, because I love it. I just sat there listening to evidence, and the midwife actually came to testify. And, you know, like, I see why it is actually such a tricky area, medical negligence, because that midwife was convinced she did everything right. You know what I mean? Like, she's like, no, I did the necessary checks at this intervals, and wada. And then it's like, it seems like there was nothing that she could have done, you know? But I'm sure, I mean, I've just told you the story. I'm sure there's something she could have done. Like,
so,
dog, like, the
thing is, it's so tricky because, like, after giving birth, there's so much blood.
Oh, yeah.
There. That you probably think that you're seeing things clearly, or as clearly as possible, only to find that once the bleeding has stopped, you only realize it like later on that whoa, you know.
And apparently, if you take too long to stitch, and that's what happened with her, that it's now separated now. Like you can't. There's no wall like between. It's gone. So
basically, the biggest thing about stitching is just to make sure that they don't lose more blood than they should. So that's the purpose, I suppose, of stitching, because remember, like any muscle that tears or anything that gets cut, anything with blood vessels that gets cut will bleed. So the only way to stop the bleeding is to compress and to obviously then repair whatever that tear is. So that's why they try to suture as fast as possible to reduce the damage that tear can cause, you know. So I think in the heat of the moment, it can be sometimes very difficult to differentiate between structures that are there. So, and also, like, patients that are uncooperative, I mean, obviously it's very painful, you know, but it doesn't help if someone isn't gonna sit still, if someone's gonna like sort of kick you with their legs. Like, it makes it very difficult to like work accurately, you know. So it more than anything, I think it's a two-way street in the sense that like patients need to be cooperative in as much as medical practitioners or medical professionals in general, for them to be able to do their job properly, need to receive that cooperative attitude from patients, for lack of a better expression. But yeah, essentially it's a give and take. It's a give and take more than anything. Yeah.
That was quick. So food. Anyway, I also wanted to say, from a legal perspective, if you feel like you've got a medical negligence claim, you've got 3 years. To act on it. Otherwise, then your claim will become prescribed. So you can't sit on something. There are certain exceptions, though. Tricky.
Very tricky.
Yeah, but that's just. But that in terms of law, the law of prescription, that's how it works.
Yeah. Sure.
Yeah.
Okay.
Anyway, alright, guys. I think I'm done. I don't know. I can't think of anything else.
Yeah, I think that's pretty much
it. And if you have any like medical related questions, it may not be legal. It doesn't have to be legal because, it doesn't have to be legal. It can just be medical related. Then please ask. If there are questions that do come up, then maybe we'll get Lerato to come back and answer those questions in another video that has nothing to do with law, all to do with medicine.
Sure, that would be great. I'd be happy to come back, answer more questions. But yes,
Thanks
feel
for coming,
free.
dog.
Oh, anytime.
Appreciate it.
It was fun. It was actually so much fun.
I got a resident. Guys, please like, please share, please subscribe, and see you in my next video. Cheers. Bye.
Bye.